Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so discussing why and how to sell cancer and critical illness programs. These programs make up a valuable component of both the coverage of the people we visit with and a valuable part of our insurance agencies as well, in both a means of marketing and establishing additional streams of revenue for our agencies. Today's presentation is being recorded, and the link to that recording, along with this presentation, will be sent to all who have RSVP'd to today's meeting. You'll notice in the software that there is a section in there for questions. Please use that section, because as we go through the presentation, you might find that those questions are answered, but they will be addressed at least by the end of the presentation itself. One of the things that we want to do to start is bring us all on a level set as to who Premier Marketing is. Many of us are aware of that, but some folks aren't. So Premier is actually a national marketing organization founded in 1968. It's part of the Integrity Marketing Platform. We have offices across the country, and we act as an insurance wholesaler, providing insurance programs to the public through independent insurance agents such as yourself. Those contracts that we offer to those folks doing that job are at the highest possible commission levels, and recruiting contracts are available to those who qualify. As we mentioned, being founded in 1968, that means that recently we celebrated a milestone in our history, and that's the 50th anniversary of our agency. We feel that's quite an accomplishment for an organization that started as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations of its type in the country. We do so through a full insurance portfolio that includes the Medicare health programs, including Medicare Advantage and Medicare Supplement plans, and the standalone Part D prescription drug programs. We also offer a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans. We also offer long-term and short-term care programs, disability income plans, and ancillary benefits such as we visit about today, including dental, vision, and hearing programs, the critical illness and cancer plans, and hospital indemnity programs. The Medicare Advantage programs include all the national carriers and many of the strong regionals that make a difference for you in your market. That same philosophy carries over into the standalone PDP realm, where those national carriers are available to you through our organization. Our Medicare Supplement portfolio is very large and robust, and we have specific support programs in place to help you be successful in that space as well. When we visit about the ancillary products like we're about to today, there are different categories that are also offered through our organization: the dental, vision, and hearing programs and the hospital indemnity plans. But you'll notice in those categories and include the critical illness and cancer areas that you have the national leaders in both those spaces available through our organization, and we'll go into some detail on the C plans, the critical illness and cancer plans, in just a moment. Many of the people that are on this webinar or visit with us are folks that are active in the Medicare space. And so we like to look at the demographics in that area to see how these programs can be helpful to those beneficiaries and ourselves as well. And you don't come on a program like the one today without someone visiting with you about the silver tsunami, the baby boomers, 10,000 a day turning 65, one every 10 seconds. But if you look at the Medicare space and the programs that we visit about today in conjunction, age isn't the only factor, because even though there's a ton of people turning 65, some of them may delay accessing their benefits through Medicare, and there's a good portion of the folks that are Medicare beneficiaries that are not over the age of 65. These are the folks that are medically disabled and accessing their Medicare benefits because of that. The proportion of folks that come into play, and when you look at that, that's about a sixth of the Medicare population that's actually under the age of 65, and they're in dire need of our help as well. So when you look at the Medicare population overall, it's a very diverse population. When you look at the number of people that need our help because of the challenges they have with their health, or 2/3 of that population have 3+ chronic conditions and some challenges with their wallets as well. So having a diverse selection of both carriers and product in our portfolio is very important when we reach out to help the folks that are coming into Medicare, because they're actually faced with a number of choices, and the information that we can help deliver to them can help make certain that they're covered in their time of need. Because to be honest, when someone becomes a Medicare beneficiary, they don't have to take Part B. That's a choice that they make. They don't have to take additional coverage for their prescription drug coverage, the Part B coverage, and they don't necessarily have to pick up additional coverage to protect what Medicare doesn't cover fully. And so they have different choices. If they take the prescription drug program, we can help them with that. It can be an adjunct to the Medigap policies that we offer, or it could be integrated into the benefits that are available through the Medicare Part C programs. But in each of these areas, and with whatever choices that there are available at that point in time, we can help also with ancillary programs to cover some of the expenses that don't go just to a provider. And we will see through some of the statistics and information we have available that that can really add up to quite a few people. When you look at the number of folks that are deciding between the base medical coverages, we're seeing kind of an even split with the folks that are coming on to Medicare regardless of the age. And in those circumstances, there's a portion of folks that will show that they have selected to stay with original Medicare only. Those statistics don't actually break into the fact that some of these folks are covered through group insurance or through coverage through the service to the country, through VA, or perhaps through Medicare and Medicaid. But there's a portion of folks in each of these areas that need our help to address certain issues that may be especially important to them when it comes to things that are happening to their body. And that choice may be considerably different between the point we beat to death earlier in this presentation, where those individuals who are under 65 are looking at different choices, and they may have some distinct possibilities that play right into line with the coverages that we offer with the ancillary programs, because those programs are not offered just to people over the age of 65 either, but that's a large segment of the population we as agents in the senior space deal with. So that's important to note that we have details available on these different programs at different ages. And when you deal with the Medicare space, you also deal with the Medicare language. So we have a couple of different acronym guides available for you as well that will be helpful for you in deciphering some of the language used in the Medicare space. When we look at the different types of programs that are available, however, and we look at cancer insurance specifically, we're looking at a course of care for the different types of cancer that can be incredibly expensive. And when you look at some of the details that are out there, if you use the mesothelioma, well, I can't pronounce it, the challenge of this particular cancer, you see that 63% of the folks that go through the treatment for the disease and their loved ones report financial struggles following a cancer diagnosis. This doesn't speak to just people that are low income or people who are uninsured or uninsured. They may include the underinsured as well, but it also looks at the blue-collar workers who face bills that are sometimes more than 4 times their annual salaries, and they can't afford some of the different cancer treatments that are out there. When you look at some of the other statistics, it's actually mind-boggling the number of folks that are affected by this disease or this category of disease. And if you think in your own personal life, how people in your own nuclear family, or at least the family beyond that, or your acquaintances, how many people have been affected by cancer, it just is mind-boggling. And you look at 2019, there was almost 2 million cases, new cases of cancer that was diagnosed in 2019. When you look at some of the detail of the people that are in that category that have been diagnosed, 60% of those folks are 65 or older, and it's the second leading cause of disease in the United States behind heart disease, which is what we're going to speak to next. And there are programs that cover both types of maladies. 600,000 people are expected to die from cancer in 2019. Almost 40% probability of men in the United States will face an invasive cancer diagnosis in their lifetime. And then you look at what people earn versus what the costs are of the treatments that are used to address this. You can see in many circumstances that, okay, health coverage will help in this area, it'll help here, but there are other things that aren't covered by just the standard health coverages. And some of the factors that come into play outside of that, well, we've got the treatment, of course, which is a big chunk of an effect on the financial toll, but you'll also look at the travel that might be involved. Almost 50% of the people are affected by that, and that's not covered by medical coverages in most circumstances. It's not only the lost wages that come into play when people are out to be treated. It's not just the lost wages of the people that are undergoing treatment, but it's the folks that are helping with delivering a care of those folks that are undergoing that as well. So you look at the home care and the other pieces that come into play. You also have some miscellaneous coverages that folks don't generally think of. And some of these challenges are keeping up with the regular bills because the income's not coming in and the outflow is still there and actually multiplied by the circumstance. There are nearly 1 in 5 of these folks that have cancer that are struggling to buy food. Some of them avoid doctor appointments or treatments because they can't afford it. Many of them look to lower the dose of the prescriptions that they're being treated for. And it's not just the cancer treatments, it's how it affects some of the other medications and the other course of treatment for conditions in their lives. So they're skipping some recommended treatments, and a good portion of them, showing just 1% here, are actually declaring bankruptcy because of the situation. You look at some of the specifics about what people use to treat cancer and how it may or may not be covered. You can look at some of the cost of medications, and some cancer patients may face out-of-pocket costs of nearly $12,000 a year on one medication. I can speak from personal experience that the medications that are used for cancer, and as a person battles that on an extended time period, some courses of treatment may fail initially. The follow-up treatments are never less expensive. And the medications where it says here $12,000 a year for one drug, there are medications out there that are multiples of that for 1 month's worth of treatment. In 2014, cancer patients paid $4 billion for out-of-pocket cost of cancer treatment. Out-of-pocket cost? Well, that's not just people who don't have coverage. Those are people who have coverage, and it's not enough. 11 of the 12 cancer drugs the FDA approved in 2012 were priced above $100,000 per year. And what you're seeing with a lot of the research in cancer medications is companies that are focused on medications that are incredibly expensive that when they come out. And you'll see that the medications as they're approved tend to be for specific types of cancer that are very hard to treat and are very expensive to treat. And you'll see that cancer patients are 2.5 times more likely to declare bankruptcy is healthy people. So some of these folks, when they see an average of $10,000 of new cancer drugs per month, some as high as $30,000 a month, were just a decade ago, those costs of those treatments was $4,500 as an average. So you've got a ton of additional costs that don't come into play when people think about health coverage as a general basis either. There are different things that you just don't think of. You know, sometimes because of the treatment or the illness, there are special foods that are necessary. There are additional needs for transportation to medical appointments and pharmacy that have to be worked through. If there are children involved in the family, who takes care of them? And you'll see in many times in the Medicare space, the grandparents are taking care of children as well. And so that may not be as silly of a point to bring up in the Medicare space because it's applicable. You also have a ton of other things that come into play with mental health services, dealing with depression, dealing with some of the side effects that when you lose your hair, are you going to go for a wig or other cosmetic items to address the side effects? So the costs are there. And I think that's a big part of what we have to do as agents is realize the value of these programs that address these specific issues that aren't part of a general health coverage. And that when you factor in some of the other non-cancerous conditions that are covered by critical illness programs or are very common in our life space as well, you can see how the need for these programs can be greatly affected when you factor in the prospect of having a stroke because you had chemotherapy or some of the other things that will happen. And the costs that are in play when you deal with strokes and heart attacks and going back to work and working through different types of therapy, the costs can be astronomical. When you look at heart disease itself, and don't worry, this is the last few slides of just statistics. Heart disease itself is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. One person dies every 37 seconds in the United States from cardiovascular disease. About 647,000 Americans die from heart disease each year, and that's 1 in every 4 deaths. Heart disease costs the United States about $219 billion each year in the years 2014 and 2015. It's gone up since then, obviously, and this includes the cost of healthcare services, medicines, and lost productivity due to death. When you look at coronary artery disease, this is the most common type of heart disease, killing well over 1/3 of a million people in 2017, and about 18.2 million adults aged 20 or older have cardiovascular disease as defined by coronary artery disease. About 2 in every 10 deaths from CAD happen in adults less than 65 years old. So we have to look at these programs also as being applicable for a larger prospect base, a larger beneficiary base than just the Medicare space. And you'll see that in many times with visits then for a husband and wife who are of different age, one over 65, one not, and how that's going to affect both of them. You look at heart attacks in the United States, someone has a heart attack every 40 seconds. Every year, about 800,000 Americans have a heart attack, and of these, 600,000 plus, that's the first time in that arena. And I got to tell you, the folks that have a heart attack are more susceptible to having a second. There are 200,000 people that have additional heart attacks, as I mentioned, and 1 in 5 heart attacks is silent. The damage is done, but the person is not aware of it. I can speak to that personally, where 3 years ago I had a stroke. Just felt really funny about different things, went to bed, talked about it with my visit with my primary care doctor on a regular visit about a month after it happened. And he says, well, we're at the end of the year. We've got some different things we've taken care of, let's go ahead and do some additional tests. And it showed the damage from a stroke when we weren't realizing what the challenges were and the after effects may be. So sometimes you can look at the fact that you have a heart history and may not be available with it. So one of the things that you want to look to do when you look at the different types of coverages is realize that not only are you covering a specific need, but you're also helping the individual, but you're helping your persistency and your production staying in place as an overall piece as well. And the more products you have in the house, the better that retention grows to be. One of the things by asking about this is it also differentiates you from the competitors that you have, just other people in the same space, and you don't have to be hardcore about it. One of the most effective ways of just bringing these coverages up is the Columbo close, where you're headed to the door and it's, by the way, who do you have your cancer insurance with? By the way, do you have coverage in the event of a heart attack or a stroke? And this can greatly affect the income of your agency and what it brings to you and your family. And it also opens the door to even additional ancillary coverage where you can speak to dental coverage or some of the things in the other areas that are necessary for full coverage for your prospects and clients. Speaking to long-term and short-term care, final expense coverages. It adds to the discussion that you have with your prospects and clients and gives you the opportunity to basically complete a profile on your prospects and clients that you may not have done for time circumstances, just didn't do it, whatever comes into play. It gives you then the opportunity to build a more complete profile on your prospects and clients and help look at what may be the best choices for them across the board with their coverages as well. So when you look at how do you sell cancer or critical illness programs and why you would want to, I think we've just established why you would want to. The need is there. The folks that are in these circumstances, it's the old story of do you have enough coverage? You never have enough coverage when something happens. You always have too much coverage when it comes time to pay for it. It's just a question of, can we see the value of what's being offered and how do we go about doing that? When you look at these two precise categories from the listing of carriers that we had earlier, you'll see a large number of choices. You see a lot of brand names in there. And one of the first questions many agents have is, what's the best policy? The simple answer to that is one that I heard back in the mid-'80s when I was selling life insurance with Prudential, and it's the policy that's in force when something happens. I think one of the biggest challenges we have as agents and one of the most important things that we need to do is actually mention the coverages that are available. Sometimes folks just don't know, and they don't realize that these programs, in the most part, pay in addition to any other coverage that they have. And when you look at the carriers that are offering programs in this space, these are carriers that actually really know what they're doing. They're pinpointing a source of a program to help make additional coverage available and protect your clients additionally with specific illnesses. And because they do so in a fashion that affects the rest of their portfolio, you will see many of these carriers that will give you an opportunity to electronically add these coverages to some of the other programs you may already be selling. Many of them will give you the opportunity to bundle these programs as well, where you'll see a base policy of based on cardiovascular difficulties and adding cancer coverage to that with different other riders, or vice versa, where it's the cancer policy as the base and critical illness as the add-on. You'll also see that many of these carriers will offer kind of a husband-wife deal, in a manner of speaking, or a family type of coverage through riders that you don't see in some of the other medical space that we deal with, because Medicare Advantage and Medicare Supplement plans and PDP programs, they're all based on the choice of one individual. With these programs, you can bundle in other family members as well, and the software packages and the programs that these carriers offer, well, they're suited for just that purpose. And we have different tools then that can help you recognize and fill in some of the needs. The quoting tool that we use for our Medicare Supplement programs that give you an opportunity to see what's effective in your space and what is available in their space, and also gives you the opportunity to do reviews for Medicare Supplement programs, also gives you the opportunity to add in additional coverages. So when we look at a circumstance where we're visiting with a Medicare Advantage policyholder, and they are very happy with their program, they're not going to change, what can you do in this space to add on additional coverage? Well, this particular program gives you the opportunity to select that plan, fill in the gaps of that program, and that then would bring on additional discussion. There are folks with this program who will look at the hospital indemnity program to be used as a rider to fill in that space, and that adds very well in the use of this particular system. But that then brings up the questions of what puts you in the hospital, because there are other needs outside of just a hospital stay that generate expense. And two of the biggest types of challenges that happen to our bodies that put us in the hospital are dealing with cancer or dealing with cardiovascular difficulties. These are the things that will drive people to their maximum out of pocket very quickly. That then gives you the opportunity to speak to those programs and utilize systems to address exactly what you're looking to do with adding to their coverages. You also have an electronic application system integrated into this quoting mechanism that gives you the opportunity to add these coverages and do so electronically. So it's very simple for you and the prospect and client, and also one that makes the process of continuing to add applications not only simple, but also very effective and time efficient. And let me, before we go into some of this additional support, show you some of the things as to how that actually works. When you look at the quoting tool itself, this is a program that's available to agents that are contracted with Premier Marketing without additional cost. So keep that in mind. You have the programs contracted, you have a program contracted with Premier, you have access to this tool without additional expense, and working with your health marketer, you can get it set up so you can access this without coming out of pocket for it. When you sign into the system, it'll ask for certain details to make this a usable system to cross-sell. And give me just a moment, and this will tell you, it pulls up here then the different systems that are available to you. I want to throw this out there kind of as an adjunct. I'm running down a foxhole here, but you use the scope of appointment, using this system to obtain that scope of appointment, and then storing it in this system for that required 10-year period gives you the opportunity to tell people that, hey, we're going to talk about more than just some of the base coverages. It gives you the opportunity to set up that conversation of additional coverage. And when we look at the different programs here, there's only one that takes it out of the when you speak in the Medicare space, of being able to speak to it all at the same time if we completed the scope correctly. And that's the final expense program, which would still need that 48-hour cooling off period. When we look at some of the Medicare Advantage programs in this area, let's just do a quick little example here. And let's just sort this by price. It'll bring up the Medicare Advantage programs available in that zip code. And that's the tune to Jeopardy in the back of the head that you're hearing here. And it'll tell you the different types of coverages that are available in that space for Medicare Advantage programs. If we go in and let's just select one at random, it will then give us the opportunity, when we go in there to speak, pardon me, with the program that you selected, you're basically working with the plan that the person is already on, and you go to that plan, it gives you the opportunity to fill in the gaps. So that same sort of pieces of information that are necessary to start the enrollment process also helps with, if you're selecting a program that actually is underwritten, what all you need there as well. This gives us the opportunity then to fill in the gaps and choose programs with different carriers to fill in that hospital copay. If a person at this particular point in time, and when you select these different plans, they come back with, oh, I don't see the value in just that for the hospital indemnity program to cover my hospital daily copays, it's a great way then to segue into, well, who covers your, who do you have your cancer insurance with? Because that will generate additional expenses as well. And let's discuss some of the opportunities you have to budget for that or cover those services. And that can make a great way of beginning a discussion of an overall program that can lead you to this: additional applications and additional coverages for your prospects and clients. Because when we look at it, one of the first things we have to do is bring into our mind the fact that these coverages are valuable to our prospects and clients. And that's why we beat to death the different statistics that are out there on cancer programs and our cardiovascular programs. The American Heart Association this month is going through the stroke awareness and some of the other programs that are out there, and it gives you additional detail as well. So having that information sent to you regularly by being part of the American Heart Association or the American Cancer Association as well, it gives you then the details to stay in front of the talking points that you need, but it also gives you then the opportunity to get additional details that remind you to speak of this. Because sometimes it's like, oh, I got an application, I'm done. Not necessarily. Here's some of the things we can do at Premier to help you become active in this space. This program, Assurance Bay, gives you the opportunity to create an agent profile and utilize that to contract with multiple carriers quickly. We saw the multitude of choices you have with carriers and plans that are out there. This gives you the opportunity to contract with more than one and do so electronically. Not all the carriers participate in the space, but those that do, it gives you an easy way of contracting with additional choices for your prospects and clients. We also offer a discounted errors and admissions program for qualified agents. What qualifies you? You've got to contract with us. By doing so, though, this gives you the protection you need as an independent insurance agent, because it covers you regardless of who you're contracting through for different services in the insurance space. And we need that as independent agents, because it's not commonplace for a broker to have all their business with one organization. Well, I do. I've got 90% of it, but there's this program out there that I contract with through a different organization. Or it's like I make a point of dividing out some of my programs so I can get additional support from additional agencies. Sometimes that works for individuals, sometimes it doesn't, but what always is necessary is that errors and admissions coverage to cover us regardless of whom we contract through. We also offer an opportunity to make certain that your license stays in play by offering additional bundled continuing education credits at a discount through our relationship with WebCE. We also offer you an opportunity to add to your own benefit package through a program that's a modified guarantee issue for non-cancelable DI coverage for ourselves. Discounted rate, you share in the commission, a great way to make certain that you protect your ability to create income for yourself and your agency as well. These programs, as we go through and visit on the different types of marketing techniques and different carriers that are out there, as I mentioned earlier, are recorded, and you can access them as well on our website at premiersmi.com and also through our YouTube channel. This gives you an opportunity to access these sorts of material on a 24/7 basis. I already mentioned the electronic support through the CSG quote engine, but you also have an opportunity to use that same sort of electronic support through Medicare Center to help you with your Medicare Advantage and PDP applications as well. Different programs, such as we're discussing today, can be very helpful in creating additional revenue streams for our agencies, but they also count for production for different carrier trips and incentives. And many of the carriers are also offering additional marketing dollars for folks that are active in this space. And in many circumstances, it's set up much like a MedSup program, where with a specific number of applications processed in a month, you get so much additional marketing dollars for those applications and the policies that you're processing through a carrier. Some of them are very unique in how they can help with different marketing support in that area. But those programs do also count to help you qualify for the Premier Producers Convention as well, which this year was to be a cruise from Miami to the Bahamas. 2020 information should be coming very shortly. Some of the additional things that we can do for you as well is help you with contact lists that are custom created for you, butted up against Do Not Call, because you can cold call for these sorts of programs. Can't for MA and PDP, but these programs are available for you in that area. And having programs like this can help you in community-based programs as well. We're speaking of the retail programs out there already. The agents that have successfully worked Walmart locations in the past have already been contacted about that, but there are additional opportunities through Walmart being offered as we speak, and through some of the different carriers as well. And having ancillary programs like what we're discussing today give us an opportunity to add even additional sales through prospects that have been garnered through retail marketing. Because most of the time, agents will use the retail space as a means of procuring additional prospects. They don't actually conduct the entire sales presentation at the time they meet the individual. And then with that follow-up sales presentation that they make, it gives us the opportunity to discuss these products as well. They also make a great way of discussing standalone programs in other centers of influence, such as faith-based organizations, where you can do a presentation on cancer coverage or on critical illness programs that go beyond cancer plans, the heart attack, stroke programs, and other plans that are out there. And it's a great way to integrate in this topic on a regular basis that keeps you in front of your audience through those centers of influence as well. Different providers obviously can be very helpful for you in this space if you are working with doctors and specialists. With oncologists, it's a great way of working in additional ways of making certain that that person's getting the coverage they need and helping with those different expenses that become part of caring for that individual. Because if a person's going through chemo, many times they have a person that's helping them with getting them to the appointments or to the treatments. If they don't have that individual, sometimes for the treatments, they will actually expend additional costs to get there. So some of the stuff that we're offering here today, the different programs, can really help the provider as well, because it's helping them stick to the regimen that they've set up and established. There are also different programs that will help with generating prospects based on the carrier. We see this more often with Medicare Advantage products during AEP, but different programs are available throughout the year. It depends upon your relationship with your local management, with carriers in your market. We do also offer different internet leads. A great program already well underway for final expense. Rolling out some information on Medicare as well. It's a great way of establishing programs specifically for these illnesses as well. So a final expense program can be translated into a cancer program off of the internet very simply. And we do also offer direct mail support based on production. It can drive the cost of those programs down substantially and help you maintain a consistent lead flow through a tried and true way of getting in touch with people with direct mail. All these different programs come into play as a component of what you're doing with your agency. And we'd like to help in those circumstances. Obviously, you'll receive this particular presentation with some of the statistics that you need to not only impress upon the value of these programs to your prospects and clients, but help you also understand why it's important to offer these programs, and then become proficient at some of the different software programs that are out there that can help you cross-sell very simply. Aetna, Cigna, United Healthcare, Anthem, a ton of different carriers out there, GTL, a number of the people that are active in this space, Medico, different programs, have systems that help you cross-sell. And becoming comfortable with them is kind of like riding a bicycle. First couple of times you do it without the training wheels, you're kind of shaky. The more you ride the bike, the better off you're with it. You are on operating that bicycle. This same sort of idea carries over into this space where your proficiency with the programs, not only in discussing how they lay out, but also into the value that comes with the ownership of such a program, can be an integral part of your business, and we want to help you there. Being aware of these different programs is the first step. It's the identifying the need within yourself, because people need the help that these plans bring about. It gives you then the opportunity to put this into play with your current practice and do so consistently, and it'll help you grow. You can get a detailed analysis of any of these carriers, contracting information, how the commissions work, because they will vary from plan to plan, and how that can affect your business by chatting with your health marketer. You can reach any of us here at Premier at 1-800-365-8208 or through our website at premiersmi.com. We look forward to that discussion to see what specifically in this space can be most helpful for you and how we need to put it in play and move forward. So simply put, we look forward to those discussions, and we look forward to helping you set up ancillary products as another means to protect your prospects and clients and add to the revenue flow to you and your agency. That said, I appreciate the time you spent with us here today. We look forward to visiting with you here in the very near future. Watch for the follow-up to be sent to you by email as soon as the recording updates, and we will visit with you in the very near future. That said, we look forward to that visit and wish you good selling. Thanks so much, and we'll talk to you soon.